And welcome. It is afternoon, and we're on a tight time frame. It's 1 o'clock. Gonzaga starts at 4:39, and by golly, I'm thinking there's a lot of people here that want to be home or someplace by that time. But we won't raise hands, and we won't identify the location that they're going to, but I have a feeling they might want to see that. My name is Ed Desi. I'm with the Lincoln County Health Department, and I serve as the chair of the Region 9 Healthcare Coalition. So it's really exciting to see all of you here today to kind of further our work, to further our collaborative effort, to do currently have on the screen. It identifies our mission to prepare to and at the appropriate level and in the most efficient manner. That really defines why we're here and what we're trying to achieve. And in order to achieve that, it really does take everybody in this room to get where we need to be if something were to happen in our region. So thank you for taking the time to be here and helping us to do that. Meeting housekeeping information. Wanted to just really briefly talk about emergency exits. As you know, the door you came in is probably the easiest way out for most people. We also have exits on both sides of the door, so if for some reason we had to leave the room here, those are the exits. And let's rally if we can on the way out the door in the northern parking lot. We want to make sure we get everybody out before people start to disband if for some reason we needed to evacuate. And as part of that, on the table inside the door, we do have a sign-in sheet. So if you haven't signed in on your way in, if you could do that sometime during the meeting or on your way out the door before you leave, so we have an accurate attendance of who's attended. It also provides us your contact information so that we can make you part of our distribution list. So please make sure you do that. Over here if you need Wi-Fi capabilities, so feel free to utilize that. Endurus graciously offers this room to us, and they also allow us to have food and drink in here, so feel free, if you have that with you, it is allowed. If you do have your cell phones with you, if you could please silence them, because when it gets close to game time and we're still here, I don't want to hear all the alarms going off, but that won't happen. For those of you on GoTo, we have a number of people today connected on GoTo. So we do have some periods of time where we have issues with GoTo, but we're working those out. One of those issues is questions. So for our speakers, if you're up here presenting and a question is asked of the audience, I will try to take them a microphone, but if I can't get to them with the microphone, please repeat the question because it's the microphone that sends the question out over the internet to the GoTo recipients. So the only way they're going to hear that is if somebody has a microphone in their hand. So as you know, if you're on the question and answer, so if you are, do monitor the chat function. So if you have questions, in the chat box, and we will respond to those at the appropriate time as soon as we can. So bathroom locations, if you didn't notice on your way in the door, they are just outside the first set of doors here. Help yourself at any time you need to get up, as we do not have as you need to, and we will move on from there. So just a couple of other announcements. We wanted to give folks an update. I see another important information that I just found, and I have to take my glasses off because it's close. We just received notification, and maybe some of you have received this as well, from the FBI, and we felt that it was appropriate to share with you. It is cyber criminals targeting, it's a private industries notification, and it really focuses around healthcare facilities. So that's the reason we want to bring this to you and make sure you are aware. And then basically, I'll just read the summary here. I've got 10 copies of the announcement that I'll leave on the back counter. So if you feel the need to take this and provide it to your IT folks, feel free to do that. The summary basically says, the FBI is aware of criminal actors who are actively targeting file transfer protocol, FTP servers operating in anonymous mode facilities to access protected health information. In any way, might be something you want to or IT folks know about that. So as we start, as we provide a newsletter that is put together from a lot of information that you share, a lot of information that we gather, but this newsletter has a whole wealth of information and a whole wealth of training opportunities that are out there that you or your staff might be available or might be interested in. And we wanted to share some of those with you today. A couple of them are on the screen here. But on the last page of our newsletter is a list of training opportunities. Actually, there's one going on today as well, I think it's over now. Psychological first aid training was provided in our region, facilitated at Frontier Behavioral Health. I understand they had quite a turnout of mental health professionals that were there. So it was exciting to see that event take place, and it was really exciting to see the turnout that we had from our region participate in that. Some other upcoming trainings on Thursday, March 30th, in our newsletter, there's a vaccination in the workplace webinar that you can look to and any me before you leave, or you can access the newsletter on our Healthcare Coalition website. Tuesday, April 4th, there is a disaster preparedness in hospitals and healthcare organizations within the community infrastructure. So another great training opportunity that you might be interested. This one is located at Yakima Community College, again, April 4th. For clinics and other ambulatory surgery centers, doctor's offices, we have Kitsap County Public Health District has put together a great training called Triage and Treatment Center Training. It really helps outline clinics prepare and understand what their roles and responsibilities are during a large-scale event. So it's really a great opportunity for you to sit down with people that have developed a great program to learn about what your facility might need if you're a doctor's office or a clinic to prepare for responding to disasters. So it's a great training opportunity. That is May 2nd, Tuesday. Starts at 8 o'clock, and it is here at the Honduras facility. The information is on the website. It's also in the newsletter. Another training that takes place quite often on May 9th at St. Luke's is a hospital evacuation shelter-in-place training. It's another training that has been provided on an annual basis for our hospital facilities, and I think people get a lot of great information out of that training opportunity. There may be more. My suggestion would be monitor the newsletter. It is a good newsletter, and then you can also see that at our HCC website. So our agenda today, obviously my part, introduction, running through some updates is about to wind down. I hate to say it, we did have Jessica Jimenez, who's a victim specialist for the Federal Bureau of Investigation, was scheduled to show up today. Due to some unforeseen issues, she's not able to make it. She is very discouraged and was excited to come meet with us today and share what she has learned from the Orlando nightclub shooting. And I'm sorry to say that we're not going to be able to pull that off, but she is excited and is already, I believe, on our slate for our next meeting in May. So she really wants to come and share what she's learned, and I think she's got a lot of great information when you're talking about the victims, the healthcare response system, alternate care facilities, and victim family reunification. So she's got some great information. She's a wealth of knowledge on a lot of things. She says she's FBI, but she has a lot of things that really relate to the work that we're doing. So we're going to be excited to bring her back in May to help share that. So to help fill the time on the agenda, and I probably should have warned Travis before today, but we're going to give you our impression of Who's on First by Laurel and Hardy. So you probably don't even know who Laurel and Hardy are. So no, we're just going to skip on and move beyond that. We got a couple presentations, and then as usual, what we're trying to do at this point in time, because of the CMS guidelines, we're breaking our agenda into two portions. We've got our Healthcare Coalition agenda portion, which talks about healthcare preparedness and the information that we're trying to share, the collaborations that we're trying to build. And then we're going to organization break, and this afternoon we're going to have a presentation from Daryl on emergency management planning, and we're going to spend some time in our work groups around the CMS requirements for those that want to participate in that. It's great discussion. It's facilitated for you to come together to figure out and share resources that are pertinent to your discipline. So it's a great opportunity to learn and share what you have done around the CMS requirements. So we're going to, I guess, condense the agenda a little bit, but first we're going to have Bruce Haley from Whitman County Hospital come present to us. He is going to share some information and lessons learned from their MCI exercise that they held in December. A lot of great lessons learned from a rural perspective in a hospital. The exciting thing is, and maybe he can touch on it if he knows a whole lot about it at this point, is they're also involved in an upcoming exercise with an Idaho Healthcare Coalition. As you know, healthcare doesn't stop at boundaries, so they're going to look at an MCI event, active shooter exercise taking place in Idaho, but they're looking at sharing patient transfers over into facilities in Washington. So it's great to see that cross-border relationship and collaboration, and we're excited to learn from that as well. So Bruce has some great information to share with us. Then we're going to hear from Chris Jacklich from the VA. He has facilitated a process to look at hospital paging, overhead paging, and really looking at transitioning to plain language notification instead of coded notification. So I know there's been a lot of effort around this in the past by hospitals. Systems have changed, but Chris has done a lot of work, and he's going to walk us through the process they use and where they finally came to as far as that overhead paging plain language use. We will take a little reorganization break at that point. When we come back together, Daryl will provide some information on emergency management planning. And then we're going to break up into our 4 work groups and have a facilitated discussion around those planning and policy efforts. Kind of a quick rundown of what we've got planned for today. Nobody's running to the door yet, so I guess that's a good start.